At 16, Joey Lynch was dealing with a reality no teenager should have to face.
I was diagnosed with Hodgkin's lymphoma, stage 3B, and that kick-started a long journey of treatment, remission, relapse, chemotherapy, full-body radiation, 2 different types of stem cell transplant, the last of which gave me severe, life-threatening graft versus host disease. But at the end of all that, the cancer remained. To the point that there were no curative options remaining in Australia, so I had to either make myself comfortable or try to find something overseas.
But making himself comfortable was never an option.
I was always going to keep fighting, even if the path in front of me wasn't exactly obvious.
True to his word, Joey found an experimental treatment in the US that could help his battle. The only problem, the clinical trial was going to cost more than $800,000 and it had to be paid up front.
It was certainly a daunting task for somebody such as myself. I'd been in treatment since I was 16 years old. I'd never been able to work, hold down a job, so I didn't really have that much in the way of savings.
Joey's parents remortgaged their family home and the community came out in droves to help him fund the treatment.
I'm incredibly privileged in my position, and there's so many young people that aren't in that position.
He made it to the States just in time.
If I hadn't been able to access that, my journey would have ended right there.
The trial bought Joey more time. He's now receiving a fortnightly infusion to help treat his cancer.
This other drug was a lot better suited for me. I'm still around today, which I wasn't going to be if I hadn't gotten access to this trial.
But there are many young Australians who don't get that chance.
Every year, 1,100 to 1,200 young Australians are diagnosed with cancer. Of those young people, 150 will die from their cancer diagnosis. That's one young person every 58 hours.
Clinical trials explore innovative ways to treat and prevent cancer, from the effectiveness of drugs and immunotherapies to surgical procedures. But young people are generally too old to qualify for childhood cancer trials and too young for adult trials. The types of cancer they are diagnosed with are rarer and often more difficult to treat. These cancers are under-researched and underfunded.
Often they are experiencing adult cancers and yet they're in a children's hospital, and so there won't be clinical trials for that type of cancer. Then when they enter the adult hospital system, the trials there are really targeting breast cancer, bowel cancer, not the rarer types of cancers that adolescent and young adult patients experience.
Every young person that can't access clinical trial and ends up unfortunately passing away as a result, it's a loss for the entire Australian community. They're not just losing that young person, they're losing everything that young person was going to be.
That's why Canteen has launched a new campaign to raise $500,000 to get a new clinical trial off the ground.
We can turn the dial on the mortality rates for these young cancer patients.
A cause close to Joey's heart. He joined Canteen after his first stem cell transplant 12 years ago. He's now chair of the board of directors.
Canteen's important in that it provides an environment where you can be surrounded by people that get it. There is just something particularly powerful and unique about one young person supporting another young person.
Joey refuses to give up his fight with cancer, and now he's fighting for all young Australians to have access to these life-changing trials.
We should be, as a community, rallying around them because we will be able to access and take advantage of the amazing contributions they will make in the future when they put their cancer behind them.
So true. I mean, hope is one of the most powerful things we can give, and that's what clinical trials do, and we should be able to treat Australians in Australia, you know.
Yeah.
It's so important that we can try and get more clinical trials happening in Australia.
He's a really good advertisement for his own words about what you would have lost had we lost him.
Yeah.
Isn't that amazing?
Yeah. Well, for more information on Canteen's clinical trial campaign and to donate, head to canteen.org/trials.